Good morning, everybody. This is Katya from Katya Home Properties, and today we're gonna do something very different that we're usually doing. And honestly saying, it took me a lot of work to convince myself or to see if I really want to do this video. But then I thought to myself, if we can just help only one person with this, it's really worth it. So today we are here, and I invited Adriana Robin, my friend from forever, and Dr. Buenrostro from Guadalajara, who is a famous plastic surgeon. We are here today to talk about not the general plastic surgery that you can imagine. We are going to talk about something completely the opposite: how to and why to remove implants, breast implants. And that's exactly what happened to me and to Adriana. I was supposed to be in the Dominican Republic this May for my birthday, and instead of this, I ended up in a surgery thanks to Dr. Nacho. So it has a huge impact on my life, and I believe this is something that has to be spoken out super loud, because there are, I believe, thousands and thousands of women out there being sick without knowing that what is causing their sickness. So, Adriana, please start and help me in this conversation. I have a lot of emotions in this.
Yeah, well, my nightmare began, I think, in 2015. I already had implants since the year 1999, probably, which was a long time. And all of a sudden I started feeling really bad, like just very fatigued. I had general inflammation. After months of studying and blood tests, and doctor after doctor, finally went for a thyroid test, and that came with an autoimmune disease of the thyroid, which is called Hashimoto's. Didn't even know why I was there, but to make a very long story short, because that story lasted like 7 years, I finally bumped into a Facebook group that it's called Implant Illness, thanks to another friend of mine that just suggested it, because I have been researching everywhere and I was like devastated of losing my health, like very hard to work, even fighting with family and friends because no one understood. If doctors said, there's nothing wrong with you, you kind of start doubting yourself, and you're like, well, maybe I'm crazy, maybe I do need to have some antidepressants or something like that. So finally bumped into this group, started reading every woman in there, and discovered that it was my story over and over. And finally, I started actually looking into plastic surgeons. I had an interview with Dr. Nacho online because he's in Guadalajara and I was here in Puerto Vallarta. And I was very excited that actually one doctor believed that the symptoms that I was having and suffering were caused by implants. So I did have the interview with him. I had an interview with another 3 doctors actually, but then ended up for different reasons having the surgery here in Vallarta. And then from there, it's been a slow pace recovery, but I am a lot better. It's been 2 years since my surgery of explanting. And I've been detoxifying little by little. One of the implants was broken, completely green, weird color. It had no shell, which means that my body had eaten a lot of the toxics that come in the ingredients. And that was very hard for me to swallow, to see that, but it also started to make sense. Everything started to make sense. So I've been just trying to heal, eating better, and with the physicians that actually believe in that, just leaning there and here, supplements and friends, of course. And so yeah, that's the story. Now I'm super happy that you actually got them out too, and yes.
It's amazing how like I all of a sudden I started to feel better, obviously after the surgery and going through the healing process, and I'm still in it, but it's amazing the difference of the everyday, like the energy that I have. Like I felt down, I felt sick, usually I'm very active, and I was like, I woke up with feeling already sick without having really any serious symptoms. So I am extremely grateful, Doc.
Thank you.
So please tell us about how did you get to this point? You've been practicing as a plastic surgeon for how many years, and how you got here?
Like about 13 years. I did my plastic and reconstructive surgery program in Mexico City it's called Centro Médico Nacional 20 de Noviembre. It's a big hospital, third grade hospital, and it's really great. And after that I went to Brazil to do some two fellowships in surgery of the breast and of body cancer. And well, in all that studying and everything, they usually in that time that you don't get to know how to do the explantation. Usually at that time you just changed the implant if it was ruptured or everything, and you left the capsule in there. And after 2018, it was my first patient that came and to my office and asked me to do an explantation, and I say, okay, why? And then she said, it's because I read that maybe my implants are causing me a sickness. And well, so I did the explantation. She returned. She was looking a lot different. She was looking great. She told me she had been better each time. She didn't feel tired. She had a lot of energy. She didn't have muscle aches. She didn't have all those dermatitis problems or rashes she usually had. So I started digging up to the information there was about it's called Isha syndrome, which is an autoimmune inflammatory sickness that causes that your own body reacts to something strange that you have inside a foreign body and starts like hitting all the other parts, causing a lot of other sicknesses such as you said, like fatigue, chronic pain, low depression, stomach aches or digestive problems. And well, I started at that time. I still put implants and took implants, and after seeing more testimonies, real testimonies that I saw, I convinced myself that something was really wrong, that I have to listen to my patients and start not wanting to put implants anymore.
That's great.
You're probably the only one, right?
I think so. It's hard because I'll tell you, being really sincere, there's still patients right now coming to my office and tell me, oh, I want to put implants on, or I want to change my implants, and I have to tell them, okay, I don't put implants anymore, it's your decision, but you have to be really informed of what you're gonna do if you do it with another surgeon, that all the testimonies there are, all the articles and proof there is about the reactions that some bodies can have when having implants.
Does it have any relation with breast cancer?
Yes, right now in 2016 there was the first relationship of implants with a type of lymphoma. It's called giant cell anaplastic lymphoma, And in September of last year, there was another cancer of a squamous cell cancer, which is a type of skin cancer that also got related with the having implants. So there's right now 2 cancers related to implants that usually are not that's other causes of you being predisposed of having cancer apart from being women.
Okay, what can, sorry. I have so many questions. So obviously I'm talking about this and I'm trying to convince my friends and the people who are close to me. And I get this feedback like, oh, pero amiga, that I am super well. I don't have anything. So how do you know? It was obvious for me because I really felt bad. But if you are okay, how do you know that you're really okay? Or is this, like, do we have a percentage here that we can say that this is only happening with 20% of the women of the implant population? Do we have any statistic on that or experience?
There's no statistic right now, but there's risk factors of being a person that can have those symptoms, such as being having a genetic factor of being with having a family that has some autoimmune disease. Obesity, it's another. Deficiency of vitamin D, it's another risk factor, and having obviously something inside your body that's not yours.
Yeah, I mean, sooner or later
but it's really hard to do that because it's really hard to convince or sometimes even to inform the population or your patients about this risk. It's really hard for them to really say, oh, how can my implants that I've been with them 5, 10, 15 years can cause me dermatitis or my muscle pain or my fatigue, chronic fatigue. It's because I'm 40 or 50 years old, 60 years old, because I have 3 children, or because, I don't know, I work a lot. So
especially if everybody else tells you that it has nothing to do with it.
They try to justify.
They're like in denial because they want to get rid of the image, I think. No, but like if I go back to where it all started, it all makes sense to me. I mean, the moment you put something that is not of the body, the immune system, and that's the reason why the capsule is there. And I think that's very important to say. Of course, this is better if you explain it, but there is, the body immediately encapsulates the implant because it's something that should not be there. And so it's trying to remove it, to dissolve it. And just because of that, I think it's already the answer. The body doesn't want that there, and it's going to react.
Yeah.
So
the body usually 2 or 3 months has a really thin capsule around the implant, because if your body could, it would throw it out. Yeah, but usually it encapsulates. It does a thin capsule, which with time it will get harder and thicker each time. And if your body is of the bodies that has a good immune response, it will do a harder capsule and try to do a thicker layer of defense against this foreign body. And that's the main reason for also to take that capsule out. It's a barrier of your body, but it's the primary contact with all the toxins that can go out from the implant shell and exposed to your body.
yeah. And so going back to when I decided my surgery, because of all the research that I did, I knew that it was super important to remove the capsule, and that some doctors just didn't. They would just remove the implant and close, and that's it. And it seems that the body keeps recognizing the capsule as the toxic thing or the foreign body inside your body. So that's why
It's because there's a leakage of silicon or of toxins that stay in the capsule. There's proof we've done when we do the capsulectomy, we see the capsule and it's embedded, or I don't know how to say it, it's with the silicon particles there. So sometimes if you have a gauze or something, we've taken out also foreign objects like gauzes or something, and it's stuck to the capsule, and you can't, even though you try to take it out, there's still something there. So it's important to take everything out.
So I'm just thinking of the arguments that I'm getting, because I'm sure these are the ones that you hear as well. So when I say, okay, well, if my capsule, from one of the breasts came out completely roto, like it was, how do you say this in English? Broken. It was leaking. It was disgusting. Yellow, leaking, wakala. So that a normal ultrasound, does it show? An MRI, does it show anything that can be seen from outside?
Usually yes, but the ultrasound is
It didn't show mine.
no, it's because it's how do you say, it's operator related. You know, it's the ultrasound is a study that's operator related.
So
Which the one that the technician or the radiologist that does the ultrasound has to be really good in doing breast ultrasounds, because if he doesn't see something wrong, he will report it as normal. The MRI, it's different because it's you see everything there usually.
usually, or
Usually.
okay, that's very important. I
But
think.
there's also false positives or false negatives. I've seen MRIs that show rupture or leakage to the axillary nodes, and when I take the implants out, they're without rupture. So I don't know, and vice versa also.
In my case was the opposite. It said the implant was intact and the implant was completely broken. So the MRI, that's why all of the surgeons were like, no, that's no problem. They're
Don't
fine.
touch it.
Don't do anything. Don't change them. Because it was contained in the body, the capsule that the body created, not the implant.
And also there's a false idea that the implant is forever. And I still receive patients that say, oh, my surgeon told me that these new implants were forever and I don't have to take them out and I'll be happy all my life with them. But
There's no such a thing as
there's
forever.
nothing forever. So nothing, your body will react as it is a foreign body and will degrade the membrane of the capsule of the implant and will rupture it.
Whew. So right now you are in Guadalajara, right?
Yeah, I'm in Guadalajara right now.
How many surgeries do you have? I don't know, in a year, in a month? Like, I don't know how to categorize you.
Like usually I have one a day.
Every day, Monday
Monday to Saturday.
to Saturday.
Yeah.
Wow. And you see people coming all over the
All over
place.
the world. Yeah.
Yeah. So I mean, the word is getting out, probably. I'm not going to ask you about the reaction from your colleagues. How they?
No, there's a big reaction also because I have really near friends that say, "What are you doing?" So, well, I'm doing. Why aren't you putting implants anymore? So it's your work. You have to. If someone, that's what you live for. So if someone comes to your office and tells, "Okay, I want implants," put them. And I say, no, it's because I really believe in this. I really think that there's something we don't know, or we know it, but we us as doctors, we need a lot of things to convince us. A lot of like medicine-based proof. So usually we need more to be convinced than all the rest of the people. And it's I really tell them, oh, I'm 100% convinced that the implants are doing harm because I've seen it. It's nothing, I've not read it, I've not seen Facebook or Instagram or something else. I really know it. I'm a proof that I have a
Take
lot
them
of
out.
patients.
It's in your hands.
Yeah, and I see how the implants with 3, 4, 5 years are completely ruptured. Even though the warranty says that you can have the implants 10 years and nothing will happen to them, etc. So that's the big reason of taking without seeing the inside of the capsule, taking it out completely.
I just want to express my profound admiration for your ethical work. I think that is amazing, and it takes a lot of courage, because we also know that that's a surgery that makes a lot of money for a lot of surgeons, and your colleagues are probably a little bit like, you're disrupting their job, and you're kind of being like a rebel in the area. But I truly, truly admire you, and I thank you for being so ethical. And I think just because of that, you're just always going to do well.
Okay, doc, but still there is a very sensitive question about many of the women out there. What happens when you take this out and they're gonna be without boobs or without anything? I mean, it's an important factor for many of us.
Sure.
What do you do?
Well, there's two options. Some young women or patients tell me, okay, I only want to have my implants out, and they're okay because usually your skin can retract as when you get pregnant. It will retract if you have good quality skin and you're young. But if you have big implants and your skin is really stretched, or you have stretch marks, your skin won't retract. So we have to do a reconstruction. The reconstruction I do, it's taking the excess skin out, but leaving all your breast gland and all your breast tissue, and try to put it as a new tissue made implant, to fill up the space that was occupied by the implant. So usually there's two ways: using a flap from the lower part of your breast up, or leaving the same flap from the upper part below the nipple areola complex down, to give some projection and some volume.
Okay.
So usually if you don't have breast tissue, you can do some movements of your own of the tissue and fix it to have a nice looking breast, even though you don't have the implant.
Okay. So if somebody listens to this, how can they find you? What's the way to you? Because I am positive that there are maybe this is a wake up call for a lot of women out there. How do they find you?
Well, I'm in Guadalajara. My office is in the street Toltecas 3597. I have my Facebook page, that's Dr-Buenrostro. I have my web page, that is www.buenrostro.mx, and also my Instagram, that's dr_Buenrostro, and my YouTube page where you can see all the surgeries, which is Buenrostro Plastic Surgery.
Yeah, those are highly recommendable to see. I mean, actually, you are videotaping every surgery after whatever is coming out, so you're gonna be able to see it with your own eyes. Doc, thank you so much for this. I think this was a must, and I hope we're gonna be able to help other ones out there. Thank you very much for coming.
Thank you.
Thank you, Katya.
Thank you, guys. So please feel free to reach out to the doctor directly or ask me. I'm very happy to share my own experience on this. Thanks for watching. Have a wonderful day. Ciao.
Good.